So the contributing factors, basically, we divide them into two: risk factors and lifestyle factors. Risk factors are things which are pretty much fixed. You can't do much about it. Family history, nothing can be done about that. Race, diabetes, if it's there, then diabetes is the main cause, and you can limit the effects of the cardiovascular effects that diabetes has. You can't really reverse them once they come into play, and they're pretty much in the progressive forwards direction. Age again is something which happens to everyone, and age-related blood pressure changes also happen to everyone. The extent may be different in people, but they certainly do happen. So, for example, arteries do harden because of deposition of fat in the walls uh, and decrease in the elastic tissue. The nature of elastic tissue itself denatures along with age. So there's no stopping that. You can only retard it, but this just forwards. Age is not a disease, but it's a reality. These are the fixed risk factors. However, lifestyle factors, they can, thankfully, they can be changed, looked at and changed. If the salt intake is more, decrease the salt, and we'll be talking about salt in a bit. It's an interesting discussion. Decrease calorie intake, control obesity, increase physical activity. Hopefully, alcohol consumption is not an issue in this country. And in women, oral contraceptives has a very clear link with developing hypertension in females. So, lifestyle changes, modifications are the first things in a physician's mind to address, not the pill that is prescribed and the patient then becomes a pill popper. First, you need to discuss and convince the person to change his eating habits, his or her obesity, level of exercise, and so on. And many patients do respond to these lifestyle modifications, and they don't need any pharmacological treatment, something which physicians these days are a bit trigger happy, I would say, and they go for the medication as a first port of call, which shouldn't be the case in our new generation, hopefully.